Nursing actions for safe medication administration. You need to avoid distractions and you need to avoid taking any shortcuts. You also need to follow the 8 patient rights. Is it the right patient? You need to make sure you're checking 2 forms of verification, whether it be their armband or asking the patient for their name and their date of birth. You need to make sure it's the right medication. You need to check the MAR and check the label and compare them and make sure it's the right medication. You also need to make sure it's the right dose. You need to check the MAR and the label and compare them and make sure it's the appropriate dose. You also need to check your dosage calculations. You also need to make sure it's the right reason. Is the medication appropriate for the diagnosis? And if you're unsure about the medication, you need to look it up. You also need to make sure it's the right time. Is it the correct frequency? Is it the correct time of day? You have to make sure it's the right route. Isn't it an appropriate route? You need to make sure a patient can swallow an oral medication. The patient has a right to refuse. And you need to make sure you have the right documentation. You need to document the date and the time, but you have to do that after you administer the medication.